throughout the state, but also nationally. So we're just really proud of what we've been able to accomplish to date in such a short period of time. But really, we've been able to do that because of the experts and doctors in this field that we have leaned on heavily in terms of learning about where the need is, where we need to be putting our money to really make an impact as quickly as possible. Because as we all know, day to day, this issue only gets that much more difficult and the need becomes greater. And I think that when you talk about need, the need among children and adolescents is one of the biggest issues when you look at mental health, the mental health crisis in general. And I think, being a mom of two young girls, and I think any parent or really anyone who has a child in their life, they are our future. And I have been so saddened by the statistics that I've seen over the years, and the fact that they keep getting worse. And I don't want, the world that I live in to look this way for my girls. And so this is a gift that really hits home in particular for me, but I think for a lot of people when it comes to the need of children. The fact is that Indiana is in the bottom 20% of states in availability of child psychiatrists. But you pair it with the fact that they're also in the top half of the states in youth suicide. And those are both statistics that we all, I think, can agree we don't want to stay that way. So that is where Riley's Children's Health comes in. And what I am so happy to be announcing today is our gift of $650,000 to Riley's Children's Health, but in particular to their Be Happy program, or their Indiana Behavioral Health Access Program for youth. What they're doing is innovative and unique, and is helping children right now. And they can do so much more if they had more resources. And that's where we come in with this gift. And I could go into details of why I love this program so much, but I'm going to let the experts take over from here. I have to say, before I introduce Dr. Leslie Holvershorn, that I would be remiss if I didn't mention that I found my way to her through another connection that I had made through the state. And I asked, we want to talk to who's the best person to talk to about Indiana and the youth crisis. And they introduced me to her and said, she's it. And she really is. And I think to date, our conversation with her was the most impactful and educational conversation, albeit saddening because of the statistics. But it really has shaped a lot of where we have gone from there, from our conversation with her. She has influenced other gifts as well because of her expertise. And she already knows this, I've already told her, but she is one of my new heroes to me, and the work that she does is truly remarkable. So I'll let her take over from here and explain a little bit more about what our gift is going to be able to do for Riley Children's Health, and specifically the Be Happy program. So Leslie.
Oh, thank you, Kaylin. And I want to thank actually the entire Earthsay family and the Colts for this incredible donation and for all you're doing to eliminate the stigma around mental health. We are truly facing a crisis when it comes to child and adolescent behavioral health, and this gift will allow us to provide critical support to families in emergency situations. And our I guess the way to think about this is our state, our country, really the whole world, we simply do not have enough pediatric psychiatrists and other mental health clinicians. And the pandemic has made the problem so much worse. We're seeing the number of children and adolescents with depression, anxiety, and suicidal thoughts surge. In my 12 years of practicing psychiatry, I've never seen anything like it. I'll give you a few examples. In 2021 alone, more than 1,200 kids and adolescents came to the Riley Emergency Department for behavioral health reasons. That is by far a record. In a typical week, as many as 500 families might call Riley seeking outpatient care for their kids. And some families are waiting months, many months, just to be seen in a variety of different settings. So this donation will help us expand the Indiana Behavioral Health Access Program for youth. We call it an acronym, the Be Happy program. It's a hotline that allows primary care and other physician and non-physician providers to consult with Riley child psychiatrists when they're caring for children with behavioral health needs. So far, we've provided more than 1,000 consultations. Up until now, the program has not offered direct care to patients. We've simply given advice to physicians and other providers on diagnoses, medication management, or treatment planning. With this gift, we will be adding psychologists, child mental illness psychologists, to our staff team to be able to provide assessments and evidence-based therapy to families that are in the most urgent situations when there's no other place for them to go to be seen and their primary care providers decide that they just cannot wait. The idea is that we would provide up to 12 weeks of therapy until we can transition these patients into care in their communities. And these assessments and therapy will be available both in person and virtually, so we can reach patients throughout the entire state. And importantly, providers from any health system anywhere in Indiana can call us. They just need to register for the program. So this is a hugely important addition to what we're able to offer, and I can personally attest to how scary it is for families when they know their child needs help but they cannot find it. So thank you to the IRSAs. We will really be able to increase our support for those most in need. So with that, I want to now introduce Gil Perry, the president of Riley Children's Health, to share a little bit more about what this donation means.
Thank you, Dr. Holvershorn. You and the Ursay family for this generous donation. I can tell you that it will be put to good use. Your aspiration that we can do better as a state and as a country is so true, and this is going to help us do that. What you just heard from Dr. Holvershorn is a program that is evidence-based. It works, we know it works, and these resources are going to enable us to help more kids and provide even deeper level of care than we ever have before. Everyone knows Riley as a comprehensive children's hospital. We are the state's children's hospital, and most people think about us as the care that we provide either in the emergency room or, God forbid, the life-saving care that we provide every single day. We are here to ensure optimal health and well-being for children. That includes physical, emotional, and mental health. And it's a priority for Riley Children's. It's one of my top 3 priorities as I'm new to the organization. We're going to really support the state and the region in behavioral health in a big way. As Dr. Holvershorn shared, we've got a crisis. There's a state of emergency across the country. Indiana is not immune to it. We have significant concerns as it relates to access to care. COVID has exacerbated this crisis. All of our data across the health system has shown that children are going without care. So our strategy is to really focus on a pyramid, including prevention and early detection. And the Be Happy program enables us to go into the primary care physician's office and support them and the families in the office. The idea is if we can prevent an exacerbation or a larger issue, we can prevent them from coming to the ED or even potentially needing inpatient services. We will be investing as a health system and as a community to make sure that we at Indiana are proud of how we care for kids' emotional and behavioral health. So once again, thank you to Kaylin, the Ursay family, and the Colts. We really appreciate our partnerships. We've been great partners for many years and look forward to doing a lot together.
Thank you, Gil. All right, members of the media, if anyone has any questions for our speakers, please place a note in the chat function. Any questions from our friends in the media? All righty. If there are no questions, we'll conclude this this press availability. The media, the press release will be going out any minute now. So if any members of the media have any other questions, feel free to call me or Megan Freeman.
Thank you.
Thank you all.